Hello and welcome to Recharge Clinic. Welcome. You guys just can't be serious.
Hard to take you serious.
What would you be serious for?
Yeah.
Welcome to Recharge Clinic, where we make you like you're 20 again, basically.
Mm-hmm.
Look like you're 20, feel like you're 20, act like you're 20.
Definitely act like you're 20.
Make you more immature looking.
Every day here we get a little younger.
Yes. So,
Wow.
that's what we're talking about, is anti-aging.
Mm-hmm.
The month of anti-aging. To prepare you for summer and whatever, life. Because every minute we're getting older.
Wow,
I mean, I'm not, but everyone else is.
I
I mean, I shouldn't be. I live in the Recharge Clinic. I should be getting younger.
Benjamin Button.
Yeah, I don't know who that is. I'm not old enough to know, but sure.
That's Brad Pitt, right?
Yes, when he
Who's
got younger
old
and
enough
younger.
to know who Benjamin Button
That's
is?
right.
It was a movie that was just out not that many years ago.
With Brad Pitt.
Wow.
But she was just
Recently?
born.
Yes. Okay.
I've never heard of Benjamin Button.
You never hear anything
Curious
that I bring
Case.
up. Yes.
Benjamin Button.
I mean, it was maybe 5 years ago, 6 years ago.
I've heard
Well.
of Benjamin Button.
Well, if you've heard of Benjamin Button, let us know in the comments. We want you to be interactive today. And if you're watching this show, share it with your friends.
Share it.
This will be the thumbnail, all of us
They are
doing
seeing
this.
A picture of
Share it.
Benjamin Button.
Oh, did you
Share it.
share the
Share it
Benjamin
again.
Button?
We're seeing Benjamin Button.
I don't know who Benjamin Button is, but whatever.
That's
Yeah.
your homework tonight, young
That's
lady.
my homework to find out. So we have a lot of fun topics today. We're going to talk about some like real anti-aging products, like things that are really going to reverse signs and keep you young. What was that one movie with Bruce Willis where
Die
he was?
Hard.
No, not Die Hard. Where he was the doctor and he had like a wife and an ex-wife.
Death becomes her.
Becomes her. Sometimes I feel like I'm living that life with you.
Oh.
And I don't know. I haven't seen the movie in a long time, so maybe I'm way off. But like, you're the doctor, and you're just like working on just keeping me as youthful as possible all
Yep.
the time, right?
I am trying to do
You're
that.
trying. He's trying.
Trying.
Yes.
I might be getting a little old for him.
And happy. I'm trying
Trying to keep me happy.
to chill her with the happy juice.
That sure was in that CBD water today. CBD and gin.
I love that movie though. Anyways, so you're, Benjamin Button. I'll find out who that is. But Death Becomes Her. That's a good movie. So, maybe we should make an IV. Like after that movie, Death Becomes Her IV.
Death Becomes
That would
Her
sound a
IV.
little scary. I think people might be.
But anyone who's seen that movie
scared.
would know what that means. Okay.
I think the Benjamin Button IV would be better.
So anyway,
Yeah.
we're moving past the button.
Everyone should share the show. if you're
Share
watching.
this show so that your friends can also look young. Don't keep it a secret. We know that you don't want to share it because you don't want them to know your secrets of how you're not aging, but really share the show so that they can stay young looking too, right? Right?
Absolutely.
Don't keep it a secret and be like, oh, I'm going to make sure that I don't tell anyone because I'm going to be the best looking one out of my friends. Yeah. Share it. Okay, so
Oh, my friends.
yeah. So today we're going to discuss peptides and human growth hormone. For short, it's HGH. We're going to talk about that at the later part of the show. So make sure you don't miss that because that is the real way to get young.
Not the fake way.
Not the fake way.
No fake news.
No fake news. So let's talk about the tabletop products first. This right here is our favorite medical skincare line that we carry. It's Zenobaji. It's actually not Zo, it's ZO. I don't know if you knew that, but they
I
wanted
do know.
to
Let's
say.
put the tabletop together.
Yeah.
It looks really pretty.
Of course, Dana did.
Nice job, Dan.
Thank you. Thank you.
Bubble.
So,
Thank you.
yes. So, ZO is our favorite line. So, today, the box that I have on there is the anti-aging kit.
Mhm.
So, it's like a no-brainer. If you don't know where to start, you've never used these products, or you're not really using anything, and you say, yeah, I need anti-aging, this is the kit that you need to swing by when you're going home or wherever and pick up, because it's got everything that you need in here to get started. So, it has exfoliating cleanser. It has the exfoliating polish. It's got the complexion renewal pads. It's got the daily power defense, and then the growth factors in here. And I think that's all of it.
So 5 steps.
Yes, this I will confirm.
There are 5
that is
steps.
5. Yep, 5 steps. So this is great for anti-aging. Pick up the box. Don't have to think. Just use those products in that order.
High grades quality skincare.
Yes.
And thinking ahead, I was just thinking, gosh, that'd be a great Mother's Day gift.
Yes, it would. It would totally be an amazing Mother's Day gift. If you want your mother to look like your sister, then she needs to get this. You like that?
Snap.
Just on that note, when I was picking up Sophia from school today,
No.
one of her friends said,
No.
"Hi, Sophia's sister." It happened. It did happen.
Mind you, she is 12.
Yeah.
They thought that maybe I was a teenager. I mean,
kind of
listen.
look like a teenager.
Thank you.
You do.
I do.
Yeah.
Yeah. So I was mistaken for a teenager today.
Guys
I
could
was
be
mistaken
twins.
for a 12-year-old.
You could be
Driving a
twins.
car.
Yeah.
I was walking up in Carline,
Sylvia's sister.
breaking all of the rules. But anyways,
Breaking the rules.
so my next tabletop product that I want to talk about, or have the wizard, Dr. Wizard, talk about, is Dr. Tieche, the anti-aging shot injection, not shot. The anti-aging shot. We do quite a bit of these actually in the clinic, because we do shots and IVs here. So tell us, what is in your magical shot? Or you don't have to tell us exactly if it's a secret, but you can tell us some of the stuff.
Right.
So one first thing I want to start with is there are some people that actually take offense to the term anti-aging.
Really?
Yes. In fact, I had a patient correct me the other day and say, "Oh, I'm not into anti-aging. I'm just into, being the best I can be at my age."
Yeah, okay.
So that's fine. That's
Yeah.
all okay.
Being
So
the
I
best
don't want to
version of
offend anybody
yourself.
saying anti-aging, because we're not stopping the hands of time.
Definitely.
We're not stopping anything. We're not turning back the hands. We're not about that we don't want to grow older, but we want to grow older and feel the best that we can and look the best that we can. So
Absolutely.
we're about for
Agree.
age optimization. Anyway, I just wanted to put that out there because
I like that.
it was burning in my
You
head.
can embrace,
and
you can
just that-
embrace our age, but
embrace it, but we don't have to,
Feel
be older
comfortable.
than what we are.
Optimizing our age.
Optimizing, yes.
Anyway, back into that injection. So really, one of the main things that causes us to look and feel older is oxidative stress. That's just what it is. Oxidative stress and inflammation are the two main things that center around all of the problems that cause problems in humans. They cause cardiovascular problems, they cause skin problems, they cause hormonal problems, they just cause us to feel bad. So the crux of this injection is it's full of antioxidants. It has lipoic acid, it has biotin, and it has glutathione in it. So those are very powerful antioxidants, all of them, which they're in our body, but also we're giving an extra little boost for them. Lipoic acid is great for your skin. It really is good for your complexion. Biotin, we know, is great for hair and nails, but it's always good for your skin. And glutathione is the best antioxidant. It really helps with liver detoxification. Glutathione. It helps with liver detoxification, but it really helps with your skin. It really just helps your skin look more youthful. So the combination of all of those together is sort of a antioxidant boost.
Gotcha.
And so we can say it's an anti-aging, or whatever term
Whatever
we want
term
to,
anyone
whatever
wants
term that
to
you're
use.
comfortable with, but that's what it's for.
Being
It's
the
for
best version
being
of
the
yourself.
best version of you shot, however that could be. Be
Best
the
version of you shot.
Best version of you
Embracing
shot.
the best
BBOY,
Yeah,
blah, blah,
absolutely.
blah.
Nothing wrong with that.
A lot of discussion.
everybody has their own comfort of what that would look like.
Yeah.
So that's kind of what that is. So we do have that can be added additionally into the IV, and you can receive those same components in an IV form
That'd
as
be
well,
really
with
good.
vitamin C and all of that other kind of stuff. So really give yourself a nice boost. In other places, in other countries, glutathione is the mainstay of really all supplements and stuff. I mean,
Good to
they're
know.
even in Indonesia. I mean, they love glutathione so much that really all the med spas, any place you go, they will give you glutathione, probably a little carelessly, but because they will just stick a needle in you and inject you with some glutathione, not knowing who
So
they are.
glutathione is not just for being an antioxidant and giving your skin a glow, it's used for also skin lightening.
Correct.
But that is at a pretty high level and a consistent basis until getting those results. So you don't have to worry about that, getting a shot, getting an IV with glutathione in it. That's not going to happen.
No.
But it's an amazing vitamin. So moving on to our next anti-aging or age optimization product is our multivitamin. We had this on the show recently, but this is so great for so many things. And one thing it really could be for is anti-aging. How? Tell us.
Well, again, it's really the same principle. You know, one of the main problems is that we fight is inflammation and an oxidative stress. And the main components of this vitamin, even though they have all the vitamins and trace minerals, the first components are vitamins A, D, E, and K. Those are all the fat-soluble vitamins, but they are all very powerful antioxidants and free radical scavengers. As you go down the list, there's a lot more other ones that are in them. There's selenium, manganese, chromium. Then there's also biotin, and all of those other things that we talked about are in that. So this thing has really got all of them in a nutshell. All, you know, as opposed to having to take several different vitamin supplements, this one really has a lot of those components that you want in one. And it's really pretty amazing the amount of some of them that are in there. Vitamin D, for example, it has a fair amount of vitamin D. You know, the average person eats between 2,000 and 4,000 units of vitamin D a day. Most typical vitamin D supplements have about 100 units in it. Basically nothing. But they say that. That's what a glass of milk has. So this has got 2,000 units in it. This is well on your way to getting your maintaining and helping to keep your vitamin D levels in the therapeutic range. And that's, we know that vitamin D is a very powerful antioxidant in our body, and it fights off lots of diseases, and we want to maintain that level high because it really has been shown to cut certain chronic diseases and cancers way down. So by having that in adequate levels and the other ones in adequate levels, you're taking something that is, you know, and it's a very great supplement as far as how it is compiled too.
Yes.
It's all natural products that were used to concentrate these vitamins. So it's not anything synthetic. It's in a capsule form, so that easily breaks down, as opposed to tablets, which are, you know, sometimes compressed very firmly, and they don't break down. Some people have a hard time breaking them down, and most of that vitamin is passed through, so they're not getting anything out of it. So,
do we have the glutathione in just the anti-aging shot, or is it also in the keto shot as well?
It's in a lot of our
that's what I was
shots.
thinking.
Yes,
I've heard it mentioned in several of the shots we've discussed. I was just keeping everybody aware. It's not just the anti-aging. It's
we have it
included
in a lot
many
of things because we really
the
like
benefits.
glutathione. Glutathione is in almost all of our IVs, and so
So I thought just makes people aware of that.
Yeah, because it's good for weight loss. It really is. Glutathione is my favorite vitamin.
I think you just like the sound of glutathione.
I like to say it.
Yeah, I think she
Really?
does
Say it
too,
first,
more
Brendan.
than anything.
Leave it to Brendan. What are we going to learn this month?
Oh, not that again.
Glutathione.
You won't forget after
I
this month.
like it because it's the most powerful antioxidant. It's the master antioxidant.
I think it's in that keto shot.
It's the Mac Daddy.
It's the Mac
I've
Daddy.
been getting the keto shots.
You've been getting the Mac Daddy.
I'm getting that on Fridays.
Mac Daddy.
Getting the Mac
Ion.
Daddy.
Mac Daddy,
Mac Daddy, I am.
Do you have a favorite vitamin?
It has switched over time. But the last 2 weeks I've been trying the keto, which does have the glutathione, high B. I enjoyed the Holiday Fat Buster might be one of my favorites.
That is. A lot of people love that.
I love that. And I also tried the Fitness Freak once or twice. That was pretty
People like that too.
Yeah, it was pretty nice.
I know. There's so many. Do you have a favorite?
No.
No. They're all your favorites, right?
I feel a little
They're
more...
all my babies, so
They're all your
they're
babies.
all
You
my
created
babies.
all
So I can't love one of my
Bye.
children more than another.
Oh, jeez.
They're all his babies.
Yeah.
I will say I feel like when the shot comes, the keto one is a little
more punch. Little punch to it.
I'm like, oh, I guess I get extra dose. You know, it's more powerful.
That's the glutathione, I think.
That's what it is.
Yeah.
I would suggest it.
I like it. Yeah. If you have not tried our keto shot,
Gotta come in.
try it. It's brand new. If you're like, oh, I didn't know about that. Yeah, because it's pretty new. It's only been out for a few weeks. So swing by, like, as you're passing the parking lot, go, and pull into Recharge Clinic and try the shot.
With that
Like,
noise.
How'd you do it?
Yeah.
Come on in. And hey, is the glutathione in that sun shot? Will we even talk?
No.
No, I don't think so.
The sun tanning shot, no, there's no
Right.
vitamins in that.
Melatonin 2.
That's melatonin and
Yeah,
melatonin
2
and
is not. That's
and
melanocyte stimulating. And when we get to that, I will talk about it.
Are we talking about that too?
Say that again.
Melanotan.
I got tan from melanotan.
That's true. It does have the word tannin, I think.
Yeah.
Okay, so moving on. Those are our products for today. March 30th. Not the last day in the month, but the day before the last day in the month is a Saturday, March 30th, from 9 to 12 or 1. I think I might have said 1 actually. Is our open house here at Recharge Clinic on 17th Street in Ocala, Florida. So we're having a lot of specials.
We
on
are
this.
actually.
Like, some of the specials are a little outrageous that I don't normally do actually. If you want to know, stay tuned or just come that day because these specials are some of our best specials and I'm not going to tell you all of them. I'll tell you the products. And,
Well, they
and
have
the
to
services.
do with our theme this month of anti-aging.
Oh, yeah.
Oh, yeah.
Oh, yeah.
Oh, yeah.
All right. These are on special. All of our shots are on special. Mesotherapy, which is a targeted fat loss, that's on special. Botox is the lowest special price we've ever
Did you hear
ever
that?
done. Ever done.
That's
Maybe it's time for me.
I don't want to
Yes.
say, yeah,
My
Brendan.
turn now.
I need to get rid of some
Your
of those lines. Our filler is on special. Our spider vein treatment is on special. All of these supplements will be on special.
Good to know.
Our ZO, CBD, multivitamins, all of that. All of our PRP is on special. Our chemical peels are on special. So a chemical peel would be great for like some spots, not every spot, right?
Mm-hmm.
Some minor skin resurfacing. Stem cell factor IV, the regenerative IV, and injections are on special. We're going to have raffles giving away free vitamin shots, free IVs, and free Botox.
Where are we going to be doing the raffles?
The raffle?
During the...
Yeah, we're going to have them sign their name. They have to come in, and then we're going to
We haven't done that before.
Nope, we haven't. We are doing it.
Wow.
Yeah.
When do you guys not work? That's what I want to know.
We work all the time.
When do you not work? You guys are always at work.
Yes, we live here.
Yeah.
Sundays we don't work.
Sundays is it.
Yep.
Sundays.
So, anyways, those are our specials. Some of the things that we're doing on March 30th. There will be an event, and I will create that event in Facebook Monday. So it's not going to be until Monday because we have some specials going on this week that are going to be ending on Saturday. So we're going to finish these specials out this week, which are very good on almost all of those products also. And then we've got the open house, which on March 30th
With
will
the
be
raffle. That'll
really,
be
really
fun.
great with the raffles. It's fun. Every time we do an open house, it's fun. It's like 3 or 4 hours of like craziness, and then we're done.
Then we're done.
So yeah, come by. It's a good time to come by if you haven't come by. If you already are a patient, it's a good time to come by and get specials on things that you love to do or maybe haven't done yet but want to try.
Great time to treat yourself when we have everything discounted the way they are.
Yes.
And by the end of this month, you're going to want to do some of this
Yeah, it'll be the
anti-aging.
end, going into April, getting close to Mother's
Yeah.
Day, so that's always a good time to
When is Mother's Day?
When
May,
is Mother's Day?
I think.
I believe the 13th, May 13th.
I'm just going to give you a heads up also that I wasn't planning on saying, but so this is our March open house, which is a great one. But you know, in April is our 3-year anniversary.
What?
So
Of
yeah,
the clinic?
yeah. So we'll be
Are you
having
having a party?
we'll be having something going on for that too. Yeah.
We're going to have a party.
What are we gonna do?
We're
That's
gonna
something
have
to
an
do with
open
threes? It'll have to be
house.
something with threes.
Yeah, specials of threes or something.
Whoa!
Stay
Whoa.
tuned. Come back. We'll get back on that.
We do know how to party.
Yeah, we do.
Yeah, you guys do.
Recharge Clinic likes to party,
Because
and then we all get the hang of it.
we're happy.
All right, so moving on to the main event.
Woohoo!
The main event today is peptides, HGH, aka the real word is human growth hormone. So this is amazing for so many things. So tell us, what are we starting with? Are we starting to talk about
Yeah, what are you
peptides,
talking about
HGH, like what?
I am going to start with kind of an overview of both.
Okay.
So what is your guys' understanding of growth hormone and peptides?
Well, I mean, I understand quite a bit of it. Let's hear what Lauren. That's where Dana knows.
That's the funny thing when I was inquiring about tonight's show. It's probably something I know the least about. So she said, Jen, you're going to learn a lot.
Yes.
Yes.
You know, I am starting. I was just mentioning that I'm taking some peptides and it's good for collagen and blah, blah, blah. You know, I found it at a health food store, you know, to mix in your drinks. But I'm seeing it's all the rage right now, having peptides and good ones, good quality. So I know it's just major anti-aging. But as far as human growth hormone, I know very little. I know the bare. So I don't want to be the one to be speaking upon it.
Okay. So
I'm going to give it to the expert.
So, as you guys may or may not know, there's a thing called andropause. And andropause is that mostly what we treat here. So that's low hormone levels. And so there's lots of things that cause andropause. You know, menopause is one of the most common ones for women. That's when, you know, they start going through the changes in their ovaries, start producing hormones. But men go through that as well. And not at that time, but just really as we have seen throughout the years, there's lots of things that cause hormone levels to go down. Mostly environmental factors, stress, toxins that we're exposed to, things like that cause testosterone, thyroid, adrenal, and estrogen levels in women to drop. And so what happens is those things are vital for our well-being as well as our bodily function and how our appearance is. So when those things go down, we start to feel not as good as we could. So there is a corollary to that called somatopause. And so that is when growth hormone goes down. So growth hormone is predominantly elevated or in its highest levels in your teens and 20s.
Right.
In your 30s, it starts dropping, much like testosterone. So,
well, I'm not 30 yet, so.
Well, when you get 30, it's going to start dropping.
I'm still 21.
So why is it important? Well, so growth hormone is really responsible. It's kind of the orchestrator of everything else. It's responsible for many of the same things that testosterone is because it's a similar type hormone. It's responsible for bone density, joints, muscle integrity, mental clarity. It has a lot of mental function attributes to it. It helps with mental clarity. It really helps stave off Alzheimer's. It helps with cardiovascular function and really all of these things. So you're saying, well, why is that different? Well, it functions a little bit differently. Really what its main thing is, it is a powerful anti-inflammatory within our body. So like I said, one of the main things that our body fights against is inflammation and oxidative stress. That's one of the main causes of low growth hormone and all of these other things.
Stress.
So what we want to do is increase that however we can to fight off of the ravages of our body and aging. So that being said, there's really several ways that we can take these things. There's growth hormone directly, which you just take this growth hormone and it actually increases that level.
The actual growth hormone.
Takes the actual growth hormone. It has to be taken by injection, and it helps increase that level. Now, what is it actually doing? So when people take growth hormone, there's many different levels that you can take it at. And so it is confusing to some people because they're like, oh, I don't want to do this, I don't want to do that. So in the lowest doses, it's considered the anti-aging one. That's at 1 to 2 units per day. That's how growth hormone is measured, in units. Okay. And that's going to really help your skin, it's going to help your joints, and it's going to help you just kind of feel and look a little bit more youthful. At higher doses, at 2 to 3 units, it helps increase muscle mass and helps really burn fat. Really helps to shred fat. Now, why is that important? That's really important because abdominal fat, visceral fat, is the single largest cause of inflammation in humans. And what it does is that causes inflammation, that causes insulin resistance, and it also causes growth hormone to be lower. So it's this battle between abdominal fat, visceral fat, with these big round bellies, or fat anywhere down there, and this battle between that and growth hormone and insulin.
So that kind of fat in your middle, that is the most, it affects your aging the most.
Yes.
Wow.
And it
That's
is
really
the
good
most,
to know. I did
it
not
is
know.
the most dangerous thing for us because it causes a lot of inflammation. So what happens is it causes insulin resistance. So we all know about insulin. That causes adult onset diabetes. So what happens
which
is
prevalent.
when people are young and they have diabetes, they need to take insulin. So what's happened with them is their pancreas is not making enough insulin. That's why they need to take insulin. That's usually from a viral infection or something else. Adults have the opposite. Their body's pouring out insulin because the cells are not responding. And they have lots of insulin. It's caused insulin resistance. The cells are just going, screw you. We're not going to pay attention to insulin. So what happens is insulin regulates your blood sugar. So what happens is these people's blood sugars are elevated. And that's why they become adult onset diabetics. They're treated totally different, but it is all related to their diet and their body habits. So these people are generally all overweight, lack exercise, and have a very poor diet. And they end up having a problem, what's called metabolic syndrome, which is that complex of that high blood pressure, all of these things. So it's really all based on this abdominal fat. And that's one of the things that we try to target. That's one of the things that growth hormone targets. It helps decrease that amount of abdominal fat, and it helps actually burn that fat off and increase lean muscle mass.
Right.
So it's really the ultimate in treating this problem. Now, that's not really the main treatment that you want to do if someone comes in and has this visceral abdominal fat and have that. You want to put them on a diet. They have to exercise. They have to really improve their diet. But then you can add this, and it's going to really accelerate that and kind of help.
It definitely will
So
accelerate.
all of these inflammation things, even more than high cholesterol and high triglycerides, is inflammation is much more of a cause for cardiovascular disease.
Yep.
So one of the things that having high abdominal fat causes, it causes elevation in a couple of these inflammatory markers. So whatever, you can look at this thing and say, wow, your inflammation is high. Two of them. One of them is called homocysteine levels. The other one is called C-reactive protein, CRP. And that's one that we check frequently. That is the single best indicator for cardiovascular disease.
CRP?
CRP, C-reactive protein. And that's an inflammatory marker. So that's one of the things that people typically look for and say, wow, your CRP is high. You have a lot of inflammation in your body, and we need to really get that under control because your risk of heart disease is very, very high.
Wow.
Way more than cholesterol, triglycerides, and all of that everyone targets.
Interesting.
So
It is
it's based
interesting.
on your diet as well as your activity level as well as your percentage of abdominal fat. So that being said about the growth hormone, I'm going to just jump around a little bit and say, well, so growth hormone is a great thing to take, and that was the original thing that people studied. What they found was, one, growth hormone is very expensive. And when you take it, it is not always physiologically dosed. So growth hormone in your body under ideal situations is released multiple times throughout the day. And that's how we respond. It's released a lot at night. It's one of the things that helps you sleep, but also it's when your body is repairing itself at night. So that's important.
That's why resting is so important.
It is.
That's when that's producing.
And that's exactly why. And so
True.
one of the things that people looked at is, let's see, what is going on with growth hormone? So unlike other hormones like testosterone and estrogen, when they are going down in someone's body, there's actually a depletion of it. There is not any left in your body. So that's why we have to supplement it. Growth hormone's a little bit different. There's tons of growth hormone in your body, and it's stored in your pituitary gland. But what happens is those receptors just become less common, so they don't respond. So as you get older, your body has plenty of it, but it just doesn't release it. So when we would take growth hormone, we would just get that. What happens is, or what came about is, people discovered peptides. And what peptides are a group of amino acids that mimic the hormones that bind to these receptors to stimulate the release of growth hormone or many of the other factors in your body. It's not just growth hormone. So peptides most commonly talked about are things like somorelin, ipamorelin, growth hormone release peptide 2, growth hormone release peptide 6, all of these. Those all stimulate the release of growth hormone and will actually make it to be at the physiologic levels of when you were younger. Actually even better than growth hormone. So there's those peptides. But to be
Wow.
clear, there's tons of peptides. And just so you know, the peptides are available, that this is how many peptides are available. Each one of them is a peptide.
Wow.
So
The
when
sky
people
is the
talk,
limit.
yeah. So when people talk about peptides and say what I just want to take a peptide, we have to be clear because there's a lot of them.
For what reason?
For what reason? So if it's to release growth hormone and for anti-aging, well then those are probably the growth hormone release peptides and that group that we want. But there's certain peptides that stimulate. One of the ones that we talked about before, we were talking about melanotan 2. That's a melanocyte stimulating peptide. And basically what that does is that causes your body to release more melanin, which is the skin pigment that we have, so that it helps you tan. But we know that it also has some other side effects that people use to their advantage. It increases libido. And that's a nice side effect of it, or a bad side effect, whichever way you want to look at it. But it does do that. But anyway, so that's a whole nother peptide. But there's a lot of other peptides. There's some peptides that are used to fight cancer, infection, that actually help joint healing, and all sorts of stuff like that. So there are lots and lots of peptides that are available. Some work very well, some don't work so well. I mean, but there's probably a group that about 5 or 6 that are really primarily for anti-aging. Some are injectable, and some you can take orally. And so you get the option. They both will release. They will release that growth hormone, which is what we want, and in a very natural way. Now, that being said, how do we take these? How do we take these products? Well, one of the advantages or disadvantages of them is they don't work immediately. So unlike testosterone or even testosterone pellets or estrogen, even though they don't work immediately, they work within about a week. Peptides and growth hormone don't. They take at least a month to really get in and start affecting change in your body. So when you start taking them, they're causing release, but it's just a little bit slower of a process. Now, it lasts for a long time after you stop taking them. So the process starts slower and then lasts longer. So it's just a different way of taking these things. Typically, people want to be on peptides for a minimum, or growth hormone for a minimum of 4 to 6 months, because that's when you're going to see the best benefits. You're going to start seeing your body transform. You're going to see increased muscle mass. You're going to see your skin changing. You're going to see lipolysis. You're going to see fat coming off.
Wow.
And so
is that at the anti-aging dose or at?
It's at that little bit higher dose. So what's interesting is people don't really even have to exercise. They did studies of people exercising and not exercising and taking growth hormone, and they lost weight almost similarly. Now,
so that really stimulates your metabolism.
Now, that being said, honestly, we know that that's probably not the best way of doing it. We
know
that you still want to eat and exercise. That's going to be the best for your overall body health. But let me ask you,
so what if someone doesn't want to lose weight, but they're taking it for anti-aging purposes? Are they going to lose weight?
They
or just lean?
They're going to lean down a little bit. They are going to see some of that visceral fat go away. They're not going to get skinny. Their percentage of body fat will go down. Now, certainly you can override it by eating more.
Right.
But no, you're generally just going to see
good point.
When you're younger, your body has a different shape, and it's leaner just naturally. As we get older, we tend to plump out. What it's going to do is kind of transform you back to that shape a little bit, as long as you're doing your part as far as eating right and exercising. And that's why it's considered that kind of that anti-aging thing, because it's not only what it's doing for your skin, which it is doing miracles. It's working on your mind. It's working on the whole rest of your body, even on the inside of your blood vessels and everything. It's not just
it's like
one
rejuvenating
thing.
Everything.
It really is.
Not
so
just
it's
one thing.
It's right. And so people just think, well, it's just for that, or they just doing that. It's not. It really is a whole body kind of thing to make you feel better, look better, and stuff like that. And when we feel better, it's not just necessarily, well, our body feels better, our minds feel better. We have much more mental clarity. A lot of things as we get older, we become, have become more forgetful. We have more clouded thinking.
Young minds are very sharp, and the older you get, you start forgetting things.
And most of that is correlated to growth hormone as the main thing.
Factor for your mind.
And this is well known in regular medicine. They did a study with anti-aging doctors and growth hormone, endocrinologists. Both of them admit that growth hormone is the key to all of these things.
Wow.
Endocrinologists say, well, we're not going to treat it. It's just natural. You just need to grow old. Where anti-aging,
That didn't sound
Yeah.
very good.
My mom's here. I gotta go.
but anti-aging docs say, listen, we know that this is a deficiency in this. Let's treat people with that. So that's the big divergence.
Is it important? Let's say you have a 40-year-old who's like, "Oh, sign me up. I really would love this." Are you required to do a growth hormone test, a blood test on them, or is it treating by symptoms, or how does that work?
Well, that's a good question. It can be really any way. So one of the things that you can do is you can look at those levels of IGF, and which tend to be lower when growth hormones lower. IGF-1, which is a conversion product of growth hormone. So that's kind of like a blood level you can look at. That's going to be low when your growth hormone's low. So it's an indirect thing. So what you can use as a end treatment is actually either whether you're treating someone with peptides or treating someone with growth hormone is to see that level come up again. And there's a range that you want it to be in. And so that is a way of doing it. That's one way of doing it. Some people will just treat people empirically because they say, well, as you get older, yours is probably going to be lower, and treat it. Now, there are some people who say and do, if a little is good, then a lot is better.
Oh, yes.
And so growth hormone is one of those things where you do have to be careful, because if you take very high doses of it, it can cause, it can actually cause diabetes, because it causes your blood sugar to go up. It can cause a little bit of fluid retention, and so
with the right dose, it can help.
Right.
And with the wrong dose, it can actually
make things. Well, it's not going to make you really bad, but it's going to have some effects. Now,
But
how
you
do
get
we?
a bad name, like from sports,
Bodybuilders
athletes, did that hurt the process?
Of course it did.
I was waiting for that question.
Yeah.
I'm a sports person.
Of course it did. So any of these athletes who seem to be,
if a little's good, a lot's better, and they want to peak. Peak performance.
Normal with performance, probably have been using growth hormone because it is basically magical to them. So the athletes that you can really readily understand and who take a fair amount of growth hormone and are taking too much of it, but are using it for the other properties of it, are wrestlers, professional wrestlers. They're massive size. No one, you don't find people like that walking around.
So that helps
the street.
you get bigger.
Gets huge. So they get a ton of muscle
At
mass.
a very high dose, not the anti-aging
Correct.
dose.
So those doses might be 10 to 15 to 20 units per day.
Wow.
So it's a very high
That's
amount.
expensive.
It's very expensive. Now, a lot of them are buying this stuff overseas. They're buying it in black market. I'm not really sure where they're getting it, but it would be very expensive to buy that amount and use it correctly. They can go down to Mexico. A lot of people fly down to Mexico and buy this stuff. It's readily available there. There are growth hormone clinics that, will just dole it out. You can buy it from the internet that way. I mean, who knows what you're getting, but regardless, maybe it's good. So the other thing are bodybuilders. Professional bodybuilders take a lot of growth hormone, and some of them will gain up to like 10 to 20 pounds of muscle in 1 month. So it's phenomenal amounts of growth, and you can see, and you can see really. I mean, people who take a fair amount of testosterone, even that, and work out, you don't really see that type of growth. They're going to get in great shape, but to go to that next level of phenomenally big, you have to take other anabolic steroids as well as growth hormone, which is in that category. So that has given it a bad name because it's been misused, but.
Just like everything else
does.
Everything.
What about eye-hand coordination and things like that? Is that from anabolic, or does HGH provide any of that? Because that was a big part of it, is that these athletes are getting better.
They are, and it does improve mental clarity. It does improve those things because it does fix a lot of that stuff.
So make you
quick on the whatever their decisions have to be. They have to be like if you're a quarterback, right? Quick decisions.
So it does help that.
Right.
That's pretty cool.
Yeah, it is. It is in those ranges. In the higher ranges, I don't know that you're going to see all of that. So there's there's an area where there's a sweet spot where you're going to get some really good benefits and not have really much side effects.
Okay.
And then there's other ones where you're going to have some side effects, but you're willing to accept those side effects
Right.
and try to mitigate them because of what you want to get out of it. And that's what a lot of these people do. They know, honestly, some of them are very well trained. They monitor their blood sugars very well. They take lots of lab tests and stuff, but they're going to take it and maximize that out because unfortunately, in their sport, that's probably the only way they can be competitive. They can't be, at a high level just doing regular exercises and eating lots of protein. It's not going to happen. They're going to get in great shape, but not to that level of phenomenal, abnormally large muscles. Now, some of them you'll notice, one of the big side effects is you'll see some bodybuilders who have very outward protuberant abdominal muscles and stuff. Their guts will stick out. And even though they're very muscular and they have a six-pack, you'll see it kind of sticks out. There's no amount of sit-ups that's going to make that go in. And that's called growth gut. And basically what happened from them is they've taken so much growth hormone that their actually intestines and abdominal organs have gotten larger. So they're actually
unhealthy?
Wow.
They're
Really?
actually
That's got to be very unhealthy that you're enlarging your organs like
they're
that.
pressing out.
Ouch.
Well, these guys don't care about longevity.
No,
they care
obviously.
about what is going to happen now. And this is all there is. This is it. Winning
Sad.
these things and then dealing with it afterwards.
Wow.
And you can see we've had some of these people come here not to get this medication, but to be monitored. And when they stop, they deflate. It's like, because they're taking such high amounts. Now, they are still big. Let's be clear. Not that they don't go to being a toothpick, but they're not the same way. I mean, they're huge, and then they're just large.
Wow. That's crazy. It's that potent.
Yeah. Well, people do that in all aspects of life. I mean, look at models who are bulimic or anorexic or take laxatives. I mean, any of these things to get to that level to do the things that they have to do, they're going to do it. And, everyone does it. Everyone sort of has a price, I guess, and that's kind of what it is.
Now, so will you prescribe the anti-aging dose of HGH here or peptides here?
Yes, absolutely. So I like to meet with those patients first and really talk with them and really try to be clear about what they're trying to get out of it and basically what we talked about now, the side effects as well, and correct usage of it, because they are safe. They are safe in good doses, but in higher doses, they are not. And so I want people to get educated. And also, one of the things is the amount of time that it takes to, for them to become usable. I mean, if someone thinks that I'm going to take this for 2 weeks and everything's going to transform, that's not realistic. And so, you have to make sure that they're fully aware of it because it's something that's meant to transform their body. None of these transformations are going to be immediate. Even when people go on testosterone or thyroid hormone, those things are not immediate. We'd all like them to be immediate, but that's just not what they have to transform. The lower your levels are, the more transformation has to happen. It has to reconfigure your body, and now your body has to restart working. I mean, you basically went from having normal levels to 0 to now having normal levels again. Your body just doesn't switch on and off that way, and so they're going to notice changes. You're going to notice weight changes. You're going to notice body fat changes. You're going to notice changes in your skin. All of these things are going to happen. And so it's a big thing. It's that's why I do like to talk to people and have.
Now, what if someone has low testosterone and they want to get on HGH?
Well, there are some people that want to do that anyway. I think that it depends.
What do you recommend?
Well, it depends what that person's complaint is. Honestly, most the symptoms are going to be very similar and overlapping. If someone comes in and their symptoms primarily lead me to think that it's mostly low testosterone, I have low energy, weight gain, and poor mental function, low libido, things like that. Well, that's not going to be fixed entirely with growth hormone. And so, but if they're saying, listen, I want to feel generally better, I want to kind of get in better shape. I want to, kind of preserve my youthfulness and try and push off this aging process. What's the best way of doing it? It's best to come up with a plan and really, so what you want to do is optimize all aspects, not just pick one thing and say, this is the thing that we're going to target and do that. You can do that. You'll probably get some good results, but you can get much better results. And so by optimizing your testosterone, it doesn't have to be meaning putting it to a crazy level, just bringing it up into the normal range if it's low. Then checking, making sure your adrenal function is good, making sure your thyroid function is good, and then optimizing your growth hormone with either peptides or growth hormone directly. That's a balanced program. Just picking one and saying, I want to only do
a little
this.
bit at a time.
One, you're just going to have to, if you're going to just pick one and you pick growth hormone, you're going to have to spend a lot on it because you're going to have to use higher doses to get you, it's going to have to do the work of the testosterone replacement as well as the growth hormone, because it's going to have to do a lot of stuff to get you where you want. And so, yes, can it be done? But, it's like driving with a flat. Can you go fast with a flat tire? Of course you can. You just got to push the gas pedal down harder. And that's really what's happening with that. So, yes,
really not the best option.
It's not the best option. It will work, but there's better ways of really doing it and smarter ways. Absolutely. So I'm hoping that people are just not going to say, well, I want that and that's all I want, blah, blah, blah. We don't have a lot of people doing that. Honestly, they come in, they go, I hear about this. I don't know about it. What do you think about it? And after I've had that talk, I said, listen, let's do all of them, optimize everything. And because you know what? Sometimes just optimizing testosterone is enough that they feel amazing. They don't want to do anything more. And so why add a bunch more things, And so if you do, though, then you do it sequentially. And then you don't have to do as much of each one because you're getting balanced.
Good plan.
Now, peptides, there's been a lot of talk about peptides and peptide creams and peptide everything. Over the counter, though. So I know that there's some multi-level marketing companies selling peptides, and literally it's just everywhere now. So what's the difference between those peptides and the peptides that you might prescribe to someone here that is a prescription and that they can only get here? What's the difference?
Well, there's lots of precursors to the peptides, and so what they do is they'll take a group of amino acids, and these might be a pre-peptide, and put them in some of these topical things or drinks or anything like that. But you really can't get the true peptides or the effect of them, because some of them only work a certain way. Some of them only work by injection. Some of them only work at certain dosing regimens. So yeah, you can smear some of this stuff on your skin and hope for the best, and of what they might be calling it, because this is the part that people really have to be clear about. And it's really a frustrating thing, because one of the things is there's no truth in marketing, and that's what you have to accept, that all marketing pretty much is a lie, because they are going to try to trick you into using their product by using words or names that are very similar. There's many of these products that are out there that are supposedly testosterone increasing supplements, and they have names in them that sound like testosterone. And so people go, oh, it's got it in there.
Right.
They've just made up some name and assigned it to a herb and said, now I'm going to brand that. I'm going to buy this, and when I sell it, I'm calling this testosterone stimulating herb, or whatever product. People go, wow, it's testosterone stimulating thing. They just made up some bullshit, and patented it. So people, if they trying to be honest and believe what someone else is saying, would say, wow, this has got to be a good product. It says that. But if you do some research, you go, wow, what a bunch of liars. That's nothing like that. There's not really anything in here that represents anything that's real and is going to do anything. So there's some products that say clinically tested and proven to do this. When you read about what their clinical tests were, like on monkeys and not humans. And most of these lab tests have never been proven on humans at all. And if they have, they've not been any significant levels. What you can do is you can take someone's growth hormone or testosterone level and check them at different times, and they can be different. If I check your level when you first wake up for your testosterone, and then I have you do some very vigorous activity, your level is going to be higher naturally. It might be not into the normal range, but it's going to be higher. So if I have you I measure your level and I give you one of these bogus products, and then I check your level and I go, wow, look at that increase in that level. It must be related to this because you took this product and now, after exercising, your level is high. This stuff works. And that's really how they're doing that. It's total bullshit. And so it's not real. So, if it seems too good to be true, it probably is.
Yes.
Some of these products, some of these companies, like GNC, I'm sure they're going to come after me, but most of their products, their highest selling products are testosterone boosting supplements.
I saw an ad on the commercial TV today.
Oh,
I was listening when I was getting ready.
Nugenix, Testosterone.
Pick it up. They're selling
and
it
so all of these things, not one of them truly works. They're all herbal supplements that were used to increase libido, sex drive, fertility in other countries, in tribes. So they tried this herb, they tried that, and, they make you feel a certain way. They may increase your arousal. Some of them may do that, but they're not going to increase your testosterone level. And most of those products, because humans being what they are, want to feel something when they take them. Most of them have some stimulants in them, and they mostly have niacin in them. So niacin is one of those vitamins that when you take it alone, it causes flushing. And one of the things that you feel is you can get a little warmth. Your hair feels prickly when you take it. So it's in almost every energy drink, niacin. You'll taste it and it'll make your lips tingle. So what'll happen is you'll go, wow, this stuff is powerful. It is making my lips tingle. My hair's standing on end. Really, all it's doing is that's just a normal response to niacin. Like a bang, like a Monster, like a Red Bull, like any of these things. It causes flushing, and that goes away. Okay. There's no stimulation with that. There's no increase in energy level. There's no, increase in testosterone level from that. But when you drink that and you have that sensation and the caffeine kicks in, you're like, yeah, I'm getting something out of this. I know it's working. I can feel it. You're feeling it. You're feeling something all right, but it's not that.
I got a feeling.
Yeah. You can drink a lot of laxative and you're going to get a feeling after that as well. But it's not going to be the same. It's not doing it. So, I hate to rain on anyone's parade. The real deal is, and the other big problem with this is most of those supplements cost well over $100 to $200 per month.
That's nice.
And so that's very expensive. It's
really
way
nice.
more expensive to take those supplements than to actually be treated properly. It's way cheaper to be treated properly and actually get really great results.
Absolutely.
But that's what it is, and that's marketing, and that's what's happened, and that's what's out there, and they're making billions, and I'm not. But anyway, sometimes honesty maybe is not the best policy. But so anyway, that's me.
Well,
but anyway, that's what those products are.
So these peptide
the topical
things
ones
out here are
the
really
topical
not
things,
peptides.
They're not. And then this topical thing, yes, they put it in some moisturizing cream and they say, wow, look how good your skin looks, and wow, don't you feel better? I don't think it's moving the bar at all as far as you to measure IGF levels or any of those factor levels that you want to do that are true markers. I don't think you're going to see any of those change. How could it be? Growth hormone's a very regulated hormone. It's difficult to buy.
If it's real, what you're getting, you're not getting it at any store except for a pharmacy or a doctor's office.
It's super expensive.
You can't get it anywhere else.
So to just say I'm going to buy some cream and it's going to have all the same in things, how can that be? I mean, honestly, how can it be? You're not going to drive a Hyundai and think it's a Rolls Royce. I don't care if you put a decal on it and say it is. It's not. And so,
really fast exhaust.
Yeah, I mean, you can't make chicken salad out of chicken shit. And that's really what it amounts to.
Wow.
So
we're getting kicked off Facebook today.
Can, but it's gross.
Yeah, it's gross. So, I'm blunt about this because I hear these things every day. I hear people talking about it and spending their money on it and wasting money on it.
Yeah, when I saw the commercial this morning, I'm like, what is this coming to?
Yeah, that's got that football guy on it. Or whatever it is, baseball. Yeah.
Yeah, that's what he took.
I was laughing.
I know.
Yeah.
Yeah, he's been juicing everything. Anyway, so what else? You have another question about it?
Well, it's administered. We talked about that. And the difference, we talked about that. So I just really wanted to clear up, too, like the ones that they're getting and hearing about outside of a doctor's office. That those are really not what they are claiming to be. Totally different.
Yeah, do your research. It's true.
Now, I mean, there are some amino acid things that can stimulate stuff, and they might provide the precursors. As we know, just taking any vitamin supplement is going to help your body have the precursors to build these things. But is taking that going to take it the next step further? Is it going to be able to stimulate the receptors and cause the release? Is it going to be able to make sure that you're making enough testosterone? Yep. One of the problems is in low of all of these things is that you have lack of building blocks. And so that's the idea. Well, I'm going to take this. This is what you need to make testosterone. You do, but doesn't mean your body has the ability to make it.
Right.
So yes, you're taking all of these things to have it, but doesn't mean it's going to.
Yeah.
So that's part
Good
of it.
to know.
Awesome.
That was a lot to clarify because I don't think a lot of people know a lot about these topics.
It's a confusing topic.
It's very confusing.
It's very confusing, but once you kind of think about it a while, it becomes much clearer, and since it is confusing, people double talk people and get them to buy
I think
things.
it's important to know because we've seen some people come in who have been prescribed human growth hormone and or peptides and never had their hormones balanced or optimized, and they were discouraged really by it, saying, oh, that didn't really work for me, right? You've seen this?
It happens quite often. People will go to clinics and get put on this stuff.
Because the clinic is probably going to make a lot of money off of it.
They make money off of it, so they're going to go to that as opposed to saying, listen, this is what's best for you. And so they start, oh yeah, you need this, you need that, you need this, and before you know it, they're on all these things. But
they're not feeling really good.
They're not feeling any better.
Because they really haven't gotten the proper treatment.
Fix the problem.
Right.
Now that in addition to, but it's a slower process. It takes a little bit more.
Mm-hmm.
You can get people really hyped up, and people hear about growth hormone. They hear about being the fountain.
You're hearing about it a lot now.
So they know, and they're like, I'm going to get that, and everything's going to be better.
Mm-hmm.
And guess what? When it's not, that's
so
frustrating.
disappointed, yeah.
Mm-hmm. But it can be good.
It can be amazing.
Properly. It is amazing.
It is amazing.
I think one big takeaway would be optimizing hormones is key, and it's so important. If you want to add that in addition, optimizing hormones should come first. You need to have balanced hormones, and then you can add that into it, but not the other way.
Right.
Yes.
Because what's causing those to be out of balance is causing the other to be out of balance, and it's never going to fix if you kind of keep everything out of sync. And so, yeah, can it work? Yeah, but probably not as well as it ought to, or as inexpensively.
Okay, so we're going to come to a close on peptides and HGH
Good job,
and
Doc.
anti-aging.
Good job, Doc.
He's brilliant. Did you make all that up, or was it true?
I had an epiphany.
So if you're just joining us, this is about to end, but rewind and watch it because there was an amazing information session on peptides, human growth hormone, and anti-aging.
And this will be podcasted as well. So
Yes,
we'll
yes.
promote that soon on
Yes.
iTunes as soon
Yep.
as they accept us.
You'll be able to watch this over and over and every day. Just keep watching the same one. No, we have several. We have all of our shows from last year, so look back and watch
Packed
them.
with information.
March 30th is our open house. It's from 9 to 12, so don't miss that. We have amazing specials going on. And if you're in Ocala watching this right now, we still have some specials going on tomorrow and
Through
Saturday. Yep. So check out our website, rechargeocalaclinic.com. Comment below, ask questions. We'll get back to them and answer. And
What do we talk about next week?
next week,
What are we talking about?
it's a
next
surprise.
week?
Actually, we have
Yes.
possibly. We have a couple procedure videos that we're going to show
Yay.
next week on some face aesthetics, like some brand new
Good.
procedure videos that we just made. So watch next week and you can see some injections and some other stuff. Okay, we'll see you next week. Have a good night.
Bye.